Hey, what's up? It is normal for COPD patients to have their weight altered, either by excess or by defect. As lung capacity decreases, nutritional status deteriorates, which increases energy needs. Oxygen demand increases, which in turn worsens lung function. As we can see, there is a danger of entering a vicious circle. Half of those affected by COPD suffer from malnutrition, which takes away their quality of life, because it weakens both muscle strength and the immune system's response, which poses a greater risk of worsening the disease. On the other hand, the continued use of corticosteroids exposes the person to osteoporosis, which can be partially counteracted by increasing the consumption of foods rich in calcium. Osteoporosis increases the risk of hip fracture in underweight people. So in addition to consuming foods rich in calcium, it is advisable to resort to foods with high energy density, such as nuts, for example, which are easy to prepare and tasty, to combat the lack of appetite. On the contrary, it is advisable to avoid foods that fill without really nourishing, such as carbonated drinks or ultra-processed products. And even better, put yourself in the hands of a professional who gives competent advice on diet and assesses whether oral nutritional supplements are necessary. There are others who are overweight, which increases the feeling of shortness of breath and carries with it an increased risk of coronary heart disease, diabetes and hypertension. To lose weight, the main thing is to avoid overeating. In addition, the intake can be divided into 5 or 6 shots throughout the day to lighten the respiratory load. If you still have trouble breathing, opt for a soft, easy to chew, soft texture diet. If oxygen is required, it is ideal to administer it before and after a meal, since digestion requires energy, and this increases the oxygen demand. It is a good idea to avoid foods that constipate, so that belly work is not exhausting, as well as those that produce flatulence, because they increase dyspnea. Another reason to avoid carbonated drinks. In addition, legumes, cabbages, melon, onion and cucumbers should be limited to the extent that they favor gases. Cured meats and sausages such as chorizo or sausage increase the inflammatory response, which results in worsening lung function. Just the opposite of what is achieved with diets rich in fiber. And water is best taken outside of meals to maintain hydration without compromising nutrient intake. Well, so far today. In the next video we will focus on physical activity, which is the most recommended non-pharmacological treatment for COPD patients. Thank you very much, and see you in the next video.